In spite of this apparent good progress, we wish to remind our people that we are not yet out of the woods. The pandemic is at different phases of its evolution in different parts of the country. Out of the total 35,205 confirmed cases, more than half, that is 19,801, approximately 56%, are from Nairobi alone, while 2,587, or 7%, are from Kiambu, and another 2,483, or 7%, are from Mombasa. We can see, therefore, that on aggregate, 70% of the national confirmed cases are from these three counties, which also account for 80% of the cumulative samples tested so far. The national decline tendency observed is therefore largely contributed by these three counties. At individual levels, counties, some of them are showing trends in rising numbers, and these include Machakos, Kajiado, Kitui, Meru, Busia, and Nyeri, which seem to be experiencing rising numbers of confirmed cases. So what we're saying is that while the overall curve may be showing progress in a downward trend, when that curve is dismantled into counties, we still see that there are some counties where numbers are rising, and that is why we are saying we must exercise caution in interpretation of that curve. While optimistic, we urge caution as we interpret the apparent decline in positivity rate. We therefore plead with our people not to lower their guard as a result of this progress. We must continue to strictly adhere to the containment measures if we have to push in this journey to flatten our curve. We have attained this progress because of these measures that have been in place. As you may be aware, there is evidence in other countries such as Spain, Belgium, Netherlands, France, Germany, UK, and some parts of the United States, where secondary and even tertiary spikes were experienced following relaxation of some of the containment measures. The World Health Organization has provided criteria that countries may use as they make considerations for lifting restrictions. These include a decline in the number of cases by 50% over a period of 3 weeks. That is, assuming testing is optimal, the number of daily cases. Less than 5% positivity over a period of 2 weeks, again, assuming that testing is optimal. At least 80% of cases coming from known clusters. In our case, we can call Nairobi County, Mombasa County, Kiambu County, which we mentioned, as some of the known clusters. And decline in the number of deaths among confirmed cases, and continuous decline in the number of hospitalizations and ICU admissions. As the ministry and counties undertake this robust evaluation of the Kenyan situation, let us maintain the containment measures of washing our hands with soap and water, maintaining social and physical distance, wearing of face masks at all times in public places, and avoiding all forms of gathering, be they social or political. The government shall be advising the nation on the next steps as and when the situation so warrants.